It's found autosomal violet here, and we're going to talk about non-Hodgkin's lymphoma. Lymphoma occurs when the lymph node cells or lymphocytes they begin to multiply uncontrollably, producing cancerous cells that have abnormal capacity to invade other tissues throughout the body. Like we see here, the cancer cell they develop in the thymus, lymph nodes, bone marrow, and lymph. There's also tumor in the lymph nodes, the T cells, and the B cells. So there are two types of lymphoma: the Hodgkin's and non-Hodgkin's, and there are different in these two. For non-Hodgkin's, they're classified based on their cell type, origin, and the characteristics, the B cells and the T cells. The subtypes of these non-Hodgkin's, they predict based on the necessity of the early treatment, response to treatment, and all of this stuff. So the symptoms here, they're all swollen lymph nodes. Swollen lymph nodes such as this. There are also pain in the body. There are also fever that follows suit. There are also anemia, fatigue, loss of appetite, night sweat, weight loss. So non-Hodgkin's, they are common in North America, and the risk of developing increases with age, and they are common in male and female of Caucasians. Now the treatment. For the treatment of non-Hodgkin's lymphoma, we have different types of treatment, and the goal of the treatment is to eradicate as much as possible the lymphoma without causing little or no damage as much as possible to the normal cells. So the treatment is of 6 types, depending on the type of the lymphoma present, the stage of the lymphoma, and the symptoms exhibited. So the 6 types include chemotherapy, which is the use of drugs. We have the immunotherapy, including monoclonal antibodies, tyrosine kinase inhibitors. We have surgery, which is being used in rare cases. Also radiation and stem cell transplants. These treatments are either used alone or in combination, depending on the type of the non-Hodgkin's lymphoma, the stage of the lymphoma, and also the symptoms present